Today is Sunday, May 26th. I'll be leaving for California in about 4 days, and I'm trying to get prepared. Always seems like there's so much to do, but I want to make sure I get it done so when I do return home, I don't have to worry about cleaning or organizing, that I can rest and make sure I get better in rehab. So as I'm looking at my website and also to the YouTube page, I notice I've had some comments and questions, which I'm so pleased about. Please keep them coming. I'm very happy about that. So I wanted to take today to go over a couple of those. I had someone write in that they had just had fibroid surgery through the belly button. They had that done in the morning and they were out by the evening. They also wanted to let me know that there are some surgeries that can shrink the fibroids. So I wanted to discuss a little bit more about that today. So the surgery that this person was talking about, it's called a laparoscopic procedure, and that's where they use a camera and they do one small incision, sometimes a couple small incisions, to go into the abdomen. They blow it up full of gas, and they can work on the uterus or various other organs, but in this case, work on the uterus to remove fibroids, which is called a myomectomy. Sometimes the doctor has to do an open abdominal surgery, and again, the fibroids can be removed that way, which is called a myomectomy done open abdominal. Now, in a laparoscopic through the navel, one kind of incision or few, it's not always possible. If your fibroids are smaller, if you don't have multiple ones, having a laparoscopic procedure is definitely wonderful and the way to go. However, in my case, the fibroid is so large, it is above my navel about 1 to 2 inches. So it's not possible to get the camera in there because they won't be able to see down into the uterus. On the table during a laparoscopic procedure, the woman's head is slightly tilted down at an angle and her legs are slightly up to let the uterus kind of fall into place. So if they were to do that to me, they just simply could not visualize the uterus and would have to change and convert the surgery to an open abdominal. Now, a hysterectomy, which is removal of the uterus, can be done laparoscopically or open abdominal. For surgeons, who are OBGYNs, at max they've had 1 to 2 years of surgical residency to learn how to do surgery. A hysterectomy is a much easier procedure than a myomectomy, and so OBGYNs with that 1 or 2 years max of surgical residency, most of them only have that, can easily remove a uterus. However, that is not enough experience to remove fibroids, especially complex cases like mine when they're large or multiple ones. As I mentioned in a previous video, a myomectomy, removal of fibroids, can be quite bloody, and it takes a lot of time to reconstruct the uterus to bring that back together. So it takes a surgeon who has a lot of skill, training, and experience to do this. Most physicians, OBGYNs, with that couple years surgical residency, inform their patients that they could do a myomectomy, but at their discretion, if it becomes necessary for whatever reason, they reserve the right to do a hysterectomy. A lot of times they say to save the woman's life, but pretty much it's because they don't always have the skill. They open the woman up, they get in there, and they see how complex those large and multiple fibroids are, and they do convert the surgery from a myomectomy, what the woman wanted to preserve the uterus, to a hysterectomy. Right before you go into surgery, that is why when you're having a myomectomy, they always typically have you sign a paper saying, I give this doctor the right, the permission to remove my uterus. So in my case, when I went to multiple OBGYNs, they said, sure, they can do the myomectomy, but if it's deemed necessary, the surgery can be converted to a hysterectomy and to prepare myself. What they're really telling me or other patients is that the intent really is a myomectomy, but their skill level is such that when they see this complicated case, that they'll just have to remove the uterus, which is not my intent. The other thing I wanted to mention was regarding the shrinkage of fibroids. That is called uterine artery embolization, or uterine fibroid embolization. And that will shrink fibroids. It's usually done it is always done laparoscopically, where excuse me, not laparoscopically, it's gone through like a interventional radiologist. They feed a little wire, like catheterization. So they put little beads into the large arteries and essentially choke off the blood supply to the fibroids. At best, 40% shrinkage is possible. So when you have a fibroid like mine that's approaching like 16, 17, it might shrink, if I'm lucky, to 8, maybe 9 centimeters. And I had problems with pain and discomfort when the fibroid is that large, so it would not give me enough relief. Also, too, as that fibroid decays, it can become necrosis or infected and sepsis. So I am not an ideal candidate to have the shrinkage done. On my website, I will give more information about the female alternative surgery. That is the bloodless myomectomy that I am having done with lots of different techniques with Dr. Del Junco. And so I hope you will click on my website, omwardenrichment.com, to read about that, OMWARD enrichment.com. And I hope this was informational, and to let women know that even though your doctor has told you that, oh, your case is too complicated, a hysterectomy is your only choice, truly what they are saying to you is that my level of experience, I don't know how to perform a myomectomy safely on you, so I'm going to tell you what I can do for you, which is hysterectomy. If you've been given the treatment plan of hysterectomy and it is not sitting well with you, and I do highly recommend research before you pull that trigger to have a hysterectomy, look. It's not always easy to find a doctor, but they are out there. Anyways, here we are, May 26th, and thank you for tuning in.